There's a word most people never hear until a doctor says it to them in a rushed 5-minute appointment: diastasis. And here's the part that catches people off guard. This isn't just something that happens to young mothers after childbirth. Men get it. Women who never had children get it. And it becomes far more common as we move into our 60s, 70s, and 80s, whether or not anyone ever carried a pregnancy. If a bulge down the middle of your stomach has crept up on you over the years, and someone told you the only answer is a trip to the operating table under general anesthesia, I want you to pause before you sign anything. That advice, given without context, has cost people more than it ever needed to. I'm Dr. James Revealio, and over many years working with patients, I have watched too many of them get steered towards surgery for a problem that, in the large majority of cases, never required a scalpel at all. Nobody sat them down to explain what was actually happening in their own body first, what their real options were, or how much of it they could influence with a handful of consistent, low-risk habits. That's what we're going to do today, the full picture, not the rushed version. If you find this useful, subscribe to Dr. Revealio Senior Health and hit like. And while you're at it, come find us on our Telegram channel, where I share things I don't always cover here. I want to say up front that nothing here is meant to replace a conversation with your own doctor, especially if you're managing other conditions, recovering from surgery, or taking medications that affect healing. Think of this as the background you need to ask sharper questions at your next appointment, rather than nodding along to whatever gets suggested first. What diastasis actually is. Let's start with the anatomy, because once you understand it, the rest makes sense on its own. Run your hand down the center of your stomach. Underneath the skin, you have two long straps of muscle, one running down the left side, one down the right. These are the muscles people call the six-pack, even if none of us are chasing a six-pack at this stage of life. Down the middle, joining those two straps together, is a band of tough, fibrous tissue called the linea alba, Latin for the white line. That white line isn't muscle, it's connective tissue, the same category of material that makes up your ligaments and tendons. Its entire job is to act like a zipper, holding those two muscle straps snugly together along the midline of your body. That zipper is wrapped in broader sheets of connective tissue called fascia, flat, tough coverings that surround each muscle, front and back. In the middle, all of those sheets fuse into one strong seam. That seam is what keeps your abdominal wall firm and closed. But when that seam loses its strength, when the tissue becomes loose and slack instead of tight and resilient, it starts to give way under everyday pressure. The two muscle straps drift apart, and a gap opens right down the center of the stomach. That gap is diastasis recti. Think of it a bit like the seam on a well-worn pair of jeans. For years, that seam holds under pressure without you ever thinking about it. But wear it out, put repeated strain on it, or let the fabric around it thin with age, and eventually it starts to give a little at a time. Not all at once, but gradually, under the everyday pressure of just living in them. Your midline works the same way. It isn't one dramatic event that opens the gap. It's usually years of accumulated pressure meeting tissue that's had less and less spring to push back with. Why it shows up, and why age changes everything. In younger women, the most common cause is pregnancy. Over 9 months, the growing womb stretches every tissue in the belly, including that white line. If the connective tissue was strong and elastic to begin with, it usually springs back after delivery. If it wasn't, the stretch tends to stick around. But here's what often gets left out of that conversation entirely. Connective tissue doesn't just weaken from childbirth, it weakens with age. After 40, your body produces new collagen, the protein that gives connective tissue its strength and spring at a noticeably slower rate. By the time we reach our 60s and beyond, that slowdown compounds. Add in years of weight fluctuation, chronic coughing, heavy lifting, or simply decades of gravity working against you, and that midline seam can stretch open gradually, with no pregnancy involved at all. This is precisely why diastasis is far more common in older adults, men included, than most people realize. A small gap above the belly button, roughly 1/2 inch to 3/4 of an inch, isn't something to panic over. In many cases, it's simply a marker of a life fully lived, not a medical emergency. But when that gap widens to 1 inch, 2 inches, or more, it deserves real attention, not a fast referral straight to surgery. There's also a practical way to check for yourself, though I'd still want a professional to confirm anything you find. Lie on your back with your knees bent, feet flat on the floor. Place 2 or 3 fingers just above your belly button and gently lift your head and shoulders slightly off the ground, the way you would at the very start of a crunch, just the very beginning, not the full movement. You may feel a gap beneath your fingers where the muscles have separated, and you can get a rough sense of how many finger widths wide it is. This isn't a diagnosis, and it's not something to repeat as an exercise, but it can help you describe what you're feeling in clearer terms the next time you speak with your doctor. The 2 mistakes I see constantly. Mistake 1, the wrong exercises. If you have diastasis, sit-ups and crunches are the worst thing you can do, and full leg lifts aren't far behind. Here's why. When you lie on your back and curl your torso upward, or lift both legs off the ground, the pressure inside your abdomen spikes immediately, and your belly bulges outward rather than drawing in. As you keep pulling your rib cage toward your hips, that internal pressure climbs even higher, pushing everything against an already weakened midline. Every repetition stretches the gap further instead of closing it. The exercise everyone was taught builds a flat stomach is, for this specific condition, exactly the move that makes it worse. Mistake 2, rushing to surgery. When someone has a noticeable separation, they're often offered a keyhole procedure, small incisions, the muscles stitched back together, sometimes reinforced with mesh. It looks tidy from the outside. It holds. But surgeons have an old saying, and they mean it sincerely. The best operation is the one you never needed. In the large majority of cases, diastasis can be meaningfully improved and sometimes closed without ever going under the knife. That doesn't require a heroic transformation. It requires the right handful of exercises, attention to a couple of nutritional gaps, and consistency. Weigh that against the other path, general anesthesia, which is always a real physiological event for an older body, along with the recovery time, the surgical risk that rises with age, and the scar tissue that can tug and tighten the surrounding area for years afterward. Given that comparison, it makes sense to give the non-surgical route a genuine, sustained effort first, and to have this conversation directly with your own physician before deciding either way. Here's something worth sitting with. Connective tissue weakness rarely shows up in only one place. If your midline has stretched, that same underlying tissue runs through your whole body, your veins, your joints, your skin, even the valves of your heart. That's part of why diastasis tends to travel in the company of other, seemingly unrelated issues. Varicose veins, hemorrhoids, stretch marks, joints that feel looser or crack more than they used to, and in some cases a heart valve finding called mitral valve prolapse, where one of the heart's valves doesn't close quite as tightly as it should. None of this means every stomach gap signals a serious problem. Most of the time it doesn't. But it's a reasonable prompt to ask your doctor for basic blood work, including vitamin D and key mineral levels, since deficiencies in these areas are common with age and play a direct role in how well your body maintains and repairs connective tissue. Rather than viewing diastasis as a cosmetic annoyance, it's more useful to treat it as an early signal, one worth listening to while there's still plenty of time to act on it. If you've also noticed any of those other signs, veins standing out more than they used to, joints that feel a little looser, skin that bruises or stretches more easily, mention that alongside the stomach gap when you talk to your doctor. Seen together rather than as isolated complaints, they tell a more complete story, and they help your doctor look in the right direction, rather than treating each one as an unrelated standalone issue. For anyone recovering from surgery, illness, significant weight change, or simply looking to protect their midsection as the years go on, a supportive abdominal band worn for the first several weeks of recovery can take real pressure off a healing or weakened area, giving the tissue time to gradually draw back together rather than staying under constant strain. This is something to discuss with your own physician, particularly if you have other health conditions, but it's a low-risk, sensible step for many people. And because collagen production naturally slows after 40 and continues slowing from there, it's worth being patient with yourself. A gap that might close in a few weeks for someone in their 30s may take considerably longer in your 70s or 80s, and that's not a failure, that's simply biology. Consistency matters more than speed. I'd genuinely love to know where you fall. Drop your age in the comments, because it helps me know how to shape future videos for this community. Everyday posture plays a bigger role here than most people expect too. Slumping forward for long stretches, at the table, in front of the television, hunched over a phone, tends to push the abdominal contents outward against an already weakened midline, working against everything you're trying to rebuild. Sitting and standing a little taller during the day, without straining for it, takes some of that constant outward pressure off the area and gives your gentle exercises a fair chance to actually make progress. Likewise, if you deal with a chronic cough, ongoing constipation that involves a lot of straining, or you're carrying extra weight around the midsection, those are all worth addressing alongside everything else, since each one adds daily pressure exactly where you're trying to reduce it. The exercise I recommend most. Of everything I've tested with patients over the years, one simple movement stands out for its safety and effectiveness, especially for older adults who need something gentle on the joints in the back. The idea is straightforward. If you want to draw your abdominal wall back towards center, you train it to do exactly that. Here's how it works. Sit, stand, or lie down, whichever is comfortable for your body today. Pull your belly button gently back toward your spine and hold that contraction. Then, without letting your stomach relax outward, add small, controlled pulses, drawing in a little further with each one. Breathe in short, easy breaths between pulses, but keep that gentle inward tension the whole time. Continue only as long as it's comfortable, stopping well before any strain, cramping, or discomfort. There's no need to push to exhaustion, particularly if you have any cardiovascular condition, hernia, or recent abdominal surgery. In those cases, check with your doctor before starting any core exercise, gentle or otherwise. What makes this movement valuable is its accessibility. It requires no mat, no equipment, and no privacy. You can do it seated in a chair, standing at the kitchen counter, or out on your daily walk. A minute or two, once or twice a day, done consistently over weeks, tends to produce far more meaningful change than an occasional intense session. A quick note on breathing because it matters more than people expect. Never hold your breath while pulling the belly in. That spikes internal pressure in exactly the way we're trying to avoid, and it can also raise blood pressure momentarily, which matters if you're managing hypertension or heart disease. Keep breathing lightly and steadily throughout, letting the tension in your stomach stay gentle and controlled rather than clenched. If you ever feel dizzy, short of breath, or notice any new pain, stop and check in with your doctor before continuing. This should feel like a mild, sustainable effort, closer to good posture than to a workout. If you've noticed a gap or bulge down the center of your stomach, here's where I'd start. Set aside crunches and sit-ups, since for this condition, they tend to work against you rather than for you. Bring in the gentle draw-in exercise a few times a day, adjusted to what feels comfortable at your age and fitness level. Ask your doctor for a simple blood work check that includes vitamin D and key minerals. And rather than treating the gap as a purely cosmetic concern, treat it as useful information about your connective tissue more broadly, the kind of information that's worth acting on early. Most people, given time and consistency, can see real improvement without ever needing an operation, though that decision should always be made together with your own physician, who knows your full medical history. This is exactly the kind of conversation that often gets skipped in a rushed appointment, and it's exactly why this channel exists, to give you the fuller picture so you can make an informed decision about your own body. If this was helpful, subscribe to Dr. Revealio Senior Health, leave a like, and join us on Telegram, where we go deeper on topics just like this one. We're building something real here, one honest conversation at a time.